Prior to diabetes, actually, I had several other significant chronic illnesses going, but I was still ignoring those. In other words, I did not really take it into my heart and really to change my lifestyle or the way I engaged with my life from the core. So what I meant was, just first, I guess I was chronologically, I received a diagnosis of melanoma, and then I went through a minor surgery for that to remove the tissue, and then soon after that, I came down with this excruciating, painful things called gout. And then I lived with that for a good 7-8 years. Gout is a symptom where you have this saturated level of uric acid in your blood stream. And that's caused by your food or stress or the body therefore reacting to the stress, overproducing the uric acid. And either way, the uric acid is saturating your blood, and then when it reaches a certain point, it starts crystallizing. The crystal of uric acid is a sharp needle, billions of little needles stinging your extremities from inside out, and that causes a tremendous inflammation because white blood cells attacking it as a foreign object, and it creates the amazing pain. In fact, su fu is what it's known as in Chinese word. It's like the pain, even the little whiff of wind will cause you pain, that kind of thing. If I were now, if I were as knowledgeable as I am, I would have stopped and did something, but I didn't. But diagnosis, so I didn't do anything until the diagnosis of diabetes came about. And so that was the third major chronic illness that I was diagnosed with. I thought I took fairly good care of myself. I was eating well, I was exercising well, and in all these things supposedly, in my mind, was my part of the achievement mode. Nevertheless, I was looking after myself. Well, it was really, I was saved by my doctor, who had this insight and an advice from him as a really, maybe more than just being a doctor and patient relationship, as a friend. He suggested that I would consult with some Oriental medical practitioner, because he knew about the fact that a small percentage of patients, the insulin treatment may not work or may even produce negative side effects. And of course, he always knew insulin does not cure anything, but it just simply allows a patient with a type 1 diabetes to function. So he was wondering, he posed the question, so what if my body can't take the insulin? And an insulin is something that once you start, it's very difficult to get off of. So why don't we take a one step to make sure that I can do that? By that, he meant to make sure that I was a majority body type. So in order to find out this thing called body type, he used the word, I believe, metabolic profile. So if my metabolic profile is in the majority type, then he'll feel much better to use the insulin, start the insulin treatment. But he did not know the way to figure this out, and at the time, or the current Western medicine, although we talk about it, but we don't know how to do it. So he said, Oriental medicine use this body character analysis, and body constitution medicine is practiced all the time for thousands of years, and then he was certain that they come with some sort of statistical answer to us. And just so he and I both basically seek out this guy in Berkeley. He was a Zen monk practicing a thing called body constitution medicine at the time. We decided to consult with him.